Thank you all for joining us for this webinar, Secrets of a Superstar Stud Dog. My name is Shelley. I am the content manager at Revival Animal Health. In this webinar, we will be joined by Revival's Director of Veterinary Services, Dr. Marty Greer. Dr. Greer will be sharing her knowledge on male dog reproductive health. We do want to give a quick disclaimer on this webinar. Some of the images shown during the presentation will be graphic, so just want to give you a heads up on that. Now, Dr. Greer has over 40 years of experience in veterinary medicine with special interests in canine reproduction and pediatrics. She received her Doctor of Veterinary Medicine from Iowa State University in 1981, and she's served as Revival's Director of Veterinary Services since 2019. So thanks for joining us today, Dr. Greer.
Thank you. It's great to be here. Yeah, 2019. Oh man, a lot has happened since then, hasn't it? All right. So we're going to go through quite a bit of information today. I do want to just thank everybody that helped me become 2023 Veterinarian of the Year for Westminster. That was very exciting last year. I have been breeding dogs for a long time. I've talked to a few clients at Revival and they said, well, you veterinarians, you don't really understand us. And I'm like, well, actually, I probably do. I got my first Corgi in 1988 when my kids were 2 and 4. This was our first litter in 1990. So I've been doing this for a bit and I've been working with breeders for longer than that. I graduated in 81 and started my practice in 82. So basically since 1982, I've enjoyed very much working with my breeder clients. Okay, so I show and raise Pembroke Welsh Corgis, and the dog on the right is a Danish-Swedish farm dog. So I do both breeds and have had farm dogs for 10 years. They're pretty fun. We'll be a fully AKC registered breed come January of 2025. And this is the hospital that Semen built. I started breeding, working with breeder clients in 82. We moved into our second building in 1998, and then in 2008 moved into this building. And really the reason that we moved into this, because we outgrew the other building based on the amount of work we did with our breeders, primarily freezing semen and the other associated services. So it's made it a very exciting and really fun career. And I love working with my breeder clients. So it's been a lot of fun. So today we're going to talk about part 1 of the steps to building a better stud dog and more. So we're going to talk about screening for health, semen analysis, and semen collection today. Next time, so it's grayed out, is going to be the semen delivery, scratching the surface, stud dog variation, supplements, supper and snacks, surroundings, and shampoos. So those are our 7 S's. And then toward the end, we'll talk about the diagnostic workup and treatment care plan and the American Kennel Club's purebred preservation bank, their semen bank. So we're going to cover a lot of material, but only half of it today because there's too much to do in one day. So we're going to talk initially about screening for health. We're going to talk about general health screening, pain, genetic diseases, reproductive organs, temperament and anxiety, libido, structure, and sexually transmitted diseases. So in general, when we do a semen collection for a fresh breeding, for a physical exam, for breeding soundness, for a semen freezing event, any of those things, we're going to want to make sure that the male dog is overall in good general health. We know that these boys cannot produce great quality semen if they've got some kind of a health problem. And we're going to go through some of the details of them. But in general, they need to be on an appropriate diet. They need to be at good physical condition. They shouldn't be working too hard. They shouldn't be too lazy. We need somewhere in the middle. So we need these guys to be in a good housing situation where they get good daylight, good sanitation, and that they're generally a healthy, great dog. Diet is super important. And I don't think we talk about that enough for our boys. I know we talk about it a lot for our females, but for the stud dogs, it's very important as well. So we need to feed a diet that's appropriate to keep them at a good body condition, but the body isn't going to produce sperm and function as that reproductive machine that we need him to be at if we're not feeding the machine correctly. So my preferences for diet, we're going to be either the Royal Canin diet line. Of those, I really like the HT42D, which is meant to be a pregnancy diet, but it works really well for the boys too, for semen quality, because it does help manage inflammatory conditions, and inflammatory conditions can decrease semen quality. My other alternative is the Purina Sport 3020, the performance diet. So I think it's important, if you're having some issues with your stud dog, that we start off with a good, appropriate diet. And so if you're having trouble, the first place I start, whether it's a male or female, is going to be talking about nutrition. Secondly, I want to talk about pain. I know that there are some stud dogs that will see a female, be interested in breeding to her. He'll maybe approach her, maybe try to mount her, but if his back is painful, it's hard for him to mount. If he's got hip problems, maybe it's not hip dysplasia, maybe it was an injury. If he's got a cruciate rupture, those are going to be things that are going to interfere with his ability to mount the female and stay mounted long enough to achieve a breeding. And cruciates may have a genetic component to it. So I'm kind of reluctant to hold up a stud dog because he just had knee surgery if I'm in the process of collecting his semen for a breeding. So I think it's important that we talk about the genetics and the importance of not having those dogs in our gene pool. Lyme disease and other tick-borne diseases, we see a lot of them in Wisconsin. We see them in Minnesota, the upper Midwest, and of course the East Coast. And because Lyme disease can make them run a fever, make them not feel well, cause arthritis, cause some other inflammatory things. We can see Lyme nephritis, which is kidney failure due to Lyme disease. And of course, there's a multitude of other tick-borne diseases. We have anaplasmosis, we have Ehrlichia, we have Rocky Mountain spotted fever. So depending on the part of the country you're in and the ticks that are there, you may have a different tick-borne disease causing a problem. So if we're seeing fertility issues, and before we breed any of our females, we're going to want to do that test to make sure that those, the heartworm test and the Lyme and the other tick-borne diseases are negative. If we have any concerns about his mobility or his discomfort, we're going to want to do a complete orthopedic exam on this dog. So it's not just come in, collect semen, and put it in a female. I think we need to really look at the whole dog before we make those decisions. And then there can be many other disorders that can cause a dog to be reluctant to mount a bitch. So it's important that we're assessing that from a veterinarian's perspective. If we do have to try to manage these guys, whether it's orthopedic pain or genital pain, non-steroidal anti-inflammatories such as carprofen, which is Rimadyl, meloxicam, which is Medicam, can be helpful. There's a couple of others on the market as well, Daramax, Previcox, some others as well. But carprofen and meloxicam are the most commonly used. Glucosamines can help with these guys with joint lubrication. There are diets that can help with joints. So there's Hills makes JD, which stands for joint diet. Purina makes a joint diet. Royal Canin makes advanced mobility. So there's several diets on the market that are prescription in origin and really can help these guys. And of course, you have alternative treatments like chiropractic, laser, and acupuncture. Of course, rest is always a good idea. If he's injured himself or he's reluctant to breed, sometimes he just needs a little downtime. And sometimes we have to intervene with an artificial insemination, not artificial intelligence. That's a different kind of AI, but the artificial insemination to help him if he's simply not capable, but he doesn't have a genetic reason that you don't want to include him in a gene pool. Third, we want to talk about our genetic diseases that we can do testing for. Of course, we have eye diseases, heart diseases, hips and elbows that are going to require x-rays. We may have other things like the size of the trachea, the shape of the vertebrae, the dentition. And then, of course, we have DNA testing as well. Now, DNA testing has come a very long way in the last 10 years. I remember the first DNA test meeting that I went to that Elaine Ostrander put on, and it was jaw-dropping to me that we were even close to developing the canine genome understanding. Now we have over 300 genetic tests that we can do on these panels. Neogen, Embark, AKC, and other companies are running these big profiles, and they're very useful, but you do need to make sure that you're adequately understanding how to interpret those. So there are tests on there that may not influence your breed. It may not have ever been seen in your breed. So please don't assume that if they diagnose it in your dog, that that's a done deal, that he's out of the gene pool, but do call whoever's doing the testing, whichever company it is, for assistance in interpretation. So it screens for diseases, it screens for traits, and then it also, the other kinds of DNA tests that we don't need in this particular case are going to be testing for parentage, so who's the sire, and breed. You know, if you're breeding purebred dogs, you already know the breed. So it's just to have a comprehensive understanding that there are 4 categories of DNA tests. Eyes are commonly done at health clinics as are heart testing. So frequently you can find a local health clinic. I would take a look around for those rather than trying to get to see a cardiologist and then see an ophthalmologist and then see somebody for an OFA, x-ray. It can be a lot. So if you can do those things, that's all helpful. And both eye tests and DNA tests can be done while the bitch is pregnant. Hearts can also be done that way. You don't want to do any x-rays while she's pregnant for OFA. Next, I want to talk about the reproductive organs. And I think it's really overlooked a lot of times by breeders to understand these. So we're going to talk about the 7 causes of blood that comes from the penis. the penis itself, the prepuce, the prostate, the testicles, and the scrotum. So what do you do when your fabulous dog is, whether you're using him as a stud dog, whether you're using him as a fabulous dog, as a performance dog, whatever he happens to be doing, what do you do when you get into the kennel or into your kitchen one morning and you see blood dripping on the floor and it's not from your bitch and heat? So what does this mean to you? And it should mean one of seven, at least seven things. So what do you do? Are you going to Google it? Are you going to sit down and cry? Are you going to call your veterinarian? I hope you do, because that's who can help you. Can they do a blood test for this? Can we do a rectal exam? Can we do an x-ray, ultrasound, ejaculate the dog and look at the ejaculate? Can we do a cytology on that? Can we do a culture? What can we do to try and determine what's going on? So we're going to go through all of those things, including the semen analysis today. So what are the causes of blood dripping from the penis, independent of urination? Not blood in the urine, but just blood. It can be prostatitis. It can be a prostatic abscess. It can be cancer, trauma, paraprostatic cyst, urethral prolapse, or BPH. So a prostatic infection can be a bacterial prostatitis or a prostatic abscess. This is one of those graphic pictures. The bladder is on your right-hand side. The prostate is what's split open on the left-hand side. And so that's what an infected prostate looks like, if that's the case. And of course, this dog is no longer attached to these organs, so you have to understand that these are at postmortem. So that's what an infected prostate looks like. So how do we figure this out? Can you do a blood test? Well, you can do a CBC. And if it's an infection in the prostate, there should be an elevated white blood cell count. If there's a chemistry test, he may have some abnormalities in his chemistries. There is no PSA test for dogs like we have for humans to look for prostate cancer. So we're going to have to throw that off of our list. A rectal exam is a very simple exam for a veterinarian to do. Just putting a gloved finger into the rectum can tell us if the prostate is enlarged, if it's symmetrically enlarged or asymmetrical, if it's painful, what's going on there. X-rays are kind of non-specific, so I tend not to lean on those very hard unless I'm looking for something like a bladder stone or some other problem. But ultrasound really gives us the best image. We can look at the size of the prostate. We can see if there's cysts in it. If there's calcification, calcification would suggest that there may be cancer there. We can see if the bladder is also involved. If we do an ejaculation on the dog, we can look at the cytology and see what the cells look like. Do we have white blood cells, red blood cells? What do we see? Do we have bacteria? What color is the ejaculate? It should be milky white. If it's yellow, it's probably urine. If it's kind of cloudy, it's probably pus. If it's blood, well, it's blood. So there's a lot of things we can tell just by looking at it. And of course, under the microscope, we can look even further. And then we can see if there's white blood cells and bacteria suggesting an infection. And if we culture it, then we can determine exactly what antibiotic is going to be our drug of choice. So like I said, with benign bacterial prostatitis or prostatic abscess, we'll see bacteria, and it's usually secondary to BPH, which we're going to cover in some detail. These dogs can look as sick as dogs with pyometras. They can get really sick. They can have peritonitis. They can stop eating, have vomiting, fever, urinary incontinence, have a stiff gait, have septic shock, which can cause them to die. They can strain to urinate. So we're going to see some significant changes. I am going to throw in that every now and then in certain parts of the country, we can see fungal infections. It can be blastomycosis. In other parts of the country, it may be coccidiomycosis, histoplasmosis. So you need to be looking at those as well as possibilities, because we see blasto causing infections in the prostate of dogs. And sometimes that's the only presenting sign. I've seen that 4 times in dogs that's all they came in for was a prostate problem. And in reality, they had fungal pneumonia. And this is what fungal pneumonia looks like on an x-ray. It's nasty stuff. These are very difficult cases to manage. So you do need to catch these early if you are seeing a problem. And if you live in an area where those fungal diseases are endemic, you need to talk to your veterinarian about whether that's a possibility. Under the microscope, we can see white blood cells. As you can see on the right-hand side, those smaller stained cells are white blood cells. And then on the on the left-hand side, you can see a clump of white blood cells with a grouping of sperm around them. So that's what these are going to look like under the microscope. This does require an antibiotic treatment, but probably also requires a hormonal treatment. Now, this is what cancer can look like in the bladder or the prostate. And unfortunately, a lot of people assume that prostate cancer is it more common in neutered dogs or more common in intact dogs? What have you been told by your veterinarian? That you should neuter your dog because it's safer for him, because then he won't have cancer, right? Reality is adenocarcinoma and transitional cell carcinomas are more common in neutered dogs than intact dogs. So this is what prostate cancer can look like, or cancer in the bladder. Nasty disease. The treatment is very difficult. There is no surgical removal of these organs done in veterinary medicine. So it does require, of course, a long-term lifetime course of antibiotics and piroxicam to manage these guys. And you can get a little time out of them, but eventually prostate cancer is going to be a fatal disease. We can also see trauma to the penis caused by mating accidents. We can see fighting that can cause injuries. We can see dogs that go over fences or freeze to truck beds or metal surfaces when they're urinating. So a lot of things can happen to the penis. It's a very vulnerable organ. So we can see some pretty significant trauma. The other thing that we can see happen to the penis can either be paraphimosis or phimosis. A paraphimosis is an inability to retract the penis. Now, this normally happens, the times that I most commonly see this are in young dogs around 4 to 6 months old who are just starting to figure out that they have a penis. And they start figuring it out a little uncomfortably because it can get stuck. And once it gets dry, it can be very difficult to retract. It gets dry, it gets swollen. Oftentimes you do need some veterinary assistance to get this back in. A phimosis is the opposite. It's the inability to exteriorize the penis. So it would be in a situation where a dog may urinate on himself unnecessarily because he can't get his penis out, or it may be that his penile opening, the preputial opening, isn't large enough for the penis to come out to do a breeding. So if you're having fertility issues with a dog that just doesn't seem to quite be able to manage his organ correctly, then you want to talk to your veterinarian about this. Both of these can be corrected with some minor surgeries at your veterinary clinic. The next thing I want to talk about is paraprostatic cysts. And these are cysts that are associated with adjacent to the prostate, but not actually part of the prostate. Again, these are not common. I've seen only a handful of these, but on ultrasound or on x-ray, it looks like the dog has 2 bladders. So it does usually require a board certified surgeon and a neutering to correct this. But I do want you to be aware that that is a situation that we can see in dogs. Next is urethral prolapse. And this is most common in young puppies. So this isn't a dog that's old enough to have a prostate problem because he's under 5 years old. He's probably under a year old. So they're young dogs and they can come in with this urethral prolapse, which is the lining of the urethra at the end of the penis rolls out. And these guys can bleed significantly. I've seen some pretty dramatic amount of bleeding from these guys, even though it looks like that little tiny bit shouldn't cause much of a problem. We most commonly see it in the brachycephalics, like the bulldogs, the Frenchies, the pugs, but we can see it in any breed. And again, this is a surgical correction. So you want to talk to your veterinarian about this. And I probably would not include this dog in a gene pool simply because of the inheritability of this. The last thing I want to talk about regarding the prostate is benign prostatic hypertrophy or hyperplasia, BPH. It's most common in male dogs over the age of 5, even more common after age 7. Bernese Mountain Dogs, we can see it even younger, as early as 3. We can see it in the Berners. It is often mistaken by clients and by veterinarians as prostatitis. It is not an infection of the prostate. It is a hormonal disease where the dog's hormone, the testosterone that they make, changes when they get to be 5, 6, 7 years old. It changes. It causes the prostate to become large, spongy. It'll have cysts in it, sort of like Swiss cheese. I'm from Wisconsin, so we're going to talk about cheese. So it'll have cystic structures inside of it, and then they'll start to bleed. They'll just walk in dripping blood from their penis, independent of urination. So it has nothing to do with urination, has nothing to do with an infection, but it can end up with a secondary infection if it goes unrecognized and untreated. So treatment is not necessarily an antibiotic. Neutering will fix it, but neutering, of course, will then end your stud dog's career. So we do want to talk about what your alternatives are. This most commonly happens when a bitch is in heat, when a dog has been around a bitch in heat. It may be in your kennel. It may be you shared a hotel room at a dog show. It may be there's a neighborhood dog in heat. So it may not necessarily be a dog in your household, but exposure to the female will cause this to happen. And then we put the dog on antibiotics because we don't realize it's a hormonal disease. We think it's an infection because we didn't look at the ejaculate. So we put them on an antibiotic, they get better. And then 6 months later, when everybody starts to cycle again, it comes back. And so you put them back on antibiotics. And because it clears up when they're not around a female in heat, you made the assumption, as did your veterinarian, that the antibiotics fixed the problem. Well, it actually doesn't. What we actually want to do is get them on a hormonal treatment instead. So we'll see symptoms of blood dripping from the penis. We'll see dogs that strain to defecate. We'll see dogs that may have some abdominal pain when they mount a female because the prostate is enlarged. So we generally don't see dogs urinating with difficulty with this disease. It typically doesn't cause that in the male dog, but we can see these small, flat, ribbon-like stools because the prostate is pressing up on the large intestine and compressing the stools. So how do we diagnose this? Well, if you don't have X-ray, if you don't have ultrasound, if you don't have a lot of sophisticated equipment, any veterinarian can diagnose this with a gloved finger put into the rectum of the dog. It's pretty simple. If your vet says, well, your dog's too big, I can't reach the front end of the prostate, you can stand him on a flight of stairs. You can stand him on a chair, and that way his prostate will slide back. And you can also put your hand under the dog's abdomen like this veterinarian is and lift up on the prostate and meet it with your other finger. So there are several easy ways to be able to feel the prostate rectally. So on a cross section in a diagram, the prostate on the left-hand side is a normal prostate. You can see that where it says prostate gland, that's a normal size. And you can see that it's right under the large intestine. But on the right-hand side, you can see what happens with the enlarged prostate with benign prostatic hyperplasia or hypertrophy. It gets enlarged, it pushes up on the intestine. And that's why we have those flat, small ribbon-like stools, is because it's compressing the colon. So ultrasound is my favorite tool to diagnose BPH with. I've got 2 ultrasound images here of the same dog taken 30 days apart. On the left-hand side, we have a prostate that we measured 6.5 centimeters by 4.25 centimeters across on those lines that you can see. That whole thing is the prostate. And 30 days after treatment, it shrunk down to 2.5 by 2.5 centimeters. So very quickly, we can see dogs respond very well to hormonal treatment. This is not an antibiotic treatment. This is a hormonal treatment. So remember, this happens not only in middle-aged men, but also in dogs. So how do we treat it? It's very common to see. It's frequently mistaken for prostatitis, and many veterinarians will talk about antibiotics and neutering. Now, neutering is curative, but that ends his breeding career. So if you have a valuable dog that you want to keep in the breeding program, then we need to talk to your vet about a hormonal treatment. Now, the hormonal treatment is very similar. It is the same drug as Propecia that's used for men with male pattern baldness, but we use a bigger dose. Propecia is a 1 milligram dose, but the treatment that we do for dogs and most people with prostate problems, BPH in men, is going to be finasteride at a 5 milligram dose. So we can manage these dogs. We never cure the prostate problem unless we neuter them. So yes, you can neuter them. Yes, you can use an antibiotic, but that's not going to fix your hormonal problem. So we want to then reach for finasteride, which is our drug of choice, which is going to be primarily finasteride. A few times we'll use megestrol acetate if we can't get finasteride to work or we can't get a hold of it. So both of those are very effective hormonal treatments. Now, finasteride is one of those drugs that you see on the TV commercials where it says pregnant women or women who could potentially be pregnant should not handle broken tablets because of a specific kind of birth defect. And that is a serious birth defect. So any woman that may potentially be pregnant should not handle the broken tablets. And in my opinion, handle them at all. They should either wear gloves or have someone else medicate the dog. We don't want any harm to come to the pregnant woman's fetus. So I'm very careful with this drug. So what are our choices for BPH treatment? Neutering, finasteride. Neutering leaves them sterile. Finasteride leaves them fertile. And then Ovaban, which is also megestrol acetate, can result in long-term fertility as well. Antibiotics are not typically necessary for BPH unless they have BPH and a secondary bacterial infection. So that's my little spiel on prostates, and it's a really important one for you to remember. Next, we want to talk a little bit more about the penis. We can see these penises that have a penile frenulum. This dog was just at our practice a few weeks ago, and he wasn't in for this particular problem, but we were going to collect a urine sample on him. And when I exteriorized his penis, instead of it coming straight out, you could see it starts to tip downward. It kind of curves down. And that's because there's a little tiny band of tissue on the underside of the penis that didn't adequately retract when he was developing. And so it causes this penile frenulum to point him downward. If you have a normal dog that's just going to be a pet dog, it's probably not an issue. But if you have a dog that's going to be used as stud service and then he develops an erect penis during the breeding, this is going to point further and further and further downward, meaning that he's never going to be able to insert his penis into the bitch's vagina. So this is a simple procedure. Your veterinarian can fix this, but do be aware that this happens infrequently, but I've seen it. Again, we talked about the urethral prolapse. It does require surgery in most cases. So it is something to be aware of. And then this is an example of a dog that was, again, not at our practice for breeding, but this dog was in for some additional diagnostic tests. And when we exteriorized his penis, you can see that yellow pasty material that's on the underside of his penis. That's smegma. That's just an accumulation of the mucus and the other things that should adequately clear. But this dog accumulated it, and about once a year he had this happen. So if you have a stud dog that does this, you'll probably periodically want to get his penis adequately cleaned off with just some saline and some lubrication. The next part we're going to talk about for reproductive organs will be the testicles. There should be two. They should be of equal size. If we see an abnormality, if one is very large and one is very small, then the question is which is the normal and which is the abnormal. So this is an example of two testicles split open that had tumors in them. Each testicle had a different tumor. That's a little unusual. We commonly see one, but not typically two. So if one testicle is large, it may be because a tumor is in it. It may be because of an infection. If one testicle is small, it may be because the larger testicle has caused enough heat to build up in the scrotum that the other one has atrophied. We can see atrophy due to age. We can see injuries that can cause things like this. So there's a lot of reasons that we can see an abnormality in the testicular size. In the show ring, they should have two normally sized equal testicles to qualify as being in a show for breeding stock. So testicular tumors are pretty common. The really good news is that it's not serious in dogs like it is in humans. In humans, testicular cancer is a very bad disease. In dogs, typically, it's not that serious. It's easy to diagnose it. You can diagnose it if you feel your dog's testicles once in a while, just once a month or so. Check him and see if his testicles feel firm, feel equally sized, feel normal. That's great. If we see a tumor, it can lead to infertility because of the inflammation created by that tumor. So sometimes if we have a dog with one testicle that has a tumor in it and the other one is normal, we may remove the abnormal testicle, leave the other one. The atrophy may resolve when that testicle is gone, and they may still be able to be used in a breeding program. Still not for show, but they can be used in a breeding program. But they rarely spread, rarely metastasize. And they are there's three kinds of testicular tumors in dogs that are all of equal prevalence in the testicles and the scrotum. But testicular cancer is more common in the retained testicle. If it doesn't come down into the scrotum, it's either in the groin region or in the abdomen. Those testicles are more likely to develop a tumor as the dog ages. Now, a lot of veterinarians will tell you you need to take that testicle out, the retained testicle, and the answer is yes, you should, but he's not going to develop testicular cancer when he's 6 months old. So if you have a stud dog or a dog that is a male dog and you want to keep him with his abdominal testicle for a little while, you don't have to run him to surgery at 6 months, but you should by the time he's approaching young to middle age. So the three kinds of tumors that we see are going to be Sertoli cell tumors, Leydig cell tumors, and seminomas. So the Sertoli cell tumor is more common in the undescended testicle. In other words, it's at higher than normal body temperature, so it gets warm. And what will happen with Sertoli cells is they produce estrogens. So you can see dogs that develop a symmetrical hair loss. They can enlarge mammary glands. They may smell interesting to male dogs, so they may start to attract them because of the estrogen they produce. So that's the most common abnormality that we see with the Sertoli cell tumor. Neutering the dog fixes all those problems. The other two are seminomas and interstitial cell tumors, and it's sort of academic which one is which. I usually send these in if we take the testicle out to remove it. I usually send them in for histology, but basically they're all pretty much going to have the same outcome. We generally just remove it, and there's typically not chemotherapy for these guys. Testicular degeneration, unfortunately, is relatively common in dogs as they age. Once they get to be 7, 8, 9 years old, even older, we can see changes that the testicle just stops working as well as it should. It's probably still going to produce testosterone, but not the semen quality that you were accustomed to. It can also get worse with inguinal scrotal hernias. So that's a hernia where the intestinal tract slides down into the scrotum with a hernia. And we can also see this just as an idiopathic condition in middle-aged dogs. So this is where if you have a valuable stud dog, freeze his semen when he's young and he still has good semen quality. Don't wait until he's developing degeneration or other kind of senility changes that are going to require him to not have as good a semen quality. So initially you won't really see much of a difference, but eventually the testicles will become small and soft. They typically produce their normal amount of testosterone, so they'll still like girls, they'll still mount, they'll still try to breed, but you may not end up with puppies with a pregnancy. How is it diagnosed? With a biopsy. And again, this is not commonly done. Other things that we can see with testicular disorders are retained testicles. If it's one testicle, sometimes we call it monorchidism. It's technically unilateral cryptorchidism, but cryptorchidism is a retained testicle. A torsion is when the testicle twists either in the abdomen or in the scrotum and cuts off the blood flow. We can see infections of the testicle or the epididymis. We can diagnose these on ultrasound. And like I said, if there's one testicle involved and the other one is normal, you can remove just the abnormal testicle. Now, this dog had a torsion, so we removed them both. He wasn't a breeding dog. And you can see the normal testicle on the lower part of this cutting board, and then the upper testicle is the one that was torsed and had the blood flow cut off to it, and then it became diseased. Okay, so the scrotum, of course, is where the testicles reside, and it's a very delicate part of the skin structure. It can easily be damaged from wounds, too hot, too cold, laying on asphalt in the heat, frostbite in the winter, jumping over fences, catching them on, different things out running around. Disinfectants that aren't adequately diluted and rinsed off as they are used. And this is a pretty painful condition for the dog. Not only is it painful, but it increases the temperature of the scrotum, which increases the temperature of the testicles, which means he's not going to produce sperm. How long does it take to go from the beginning of spermatogenesis to the development of a fertile sperm that can fertilize a female? Does anybody know? It's 62 days. So it takes a while. You can't expect this to immediately go away. It's going to take time for this to heal, time for the testicles to get back at their normal temperature and start producing sperm again. So it should be really an important thing to you that you maintain your dog's skin in. It's super important that we do those things. The other thing that I want to make sure people do is if they're blowing dry their dogs, that they are careful to shield those testicles from the too much heat under the blower. Next, I want to just mention temperament. We see dogs that come to the practice that we have to muzzle to get a semen collection or to handle them. And my question to you is, I want you to really think hard about breeding a dog if you have to muzzle him. A male dog should be very happy to come into the vet clinic, be collected, used for breeding. That should be a pretty pleasant experience for the dog. So if you have a dog that has to be muzzled and he didn't have a terrible experience, which can happen every now and then, do you really want to keep a dog in a breeding program that's unhandleable? And my answer to that is I would not. That's up to you what you do. But I want my dogs, my boys and my girls, to be happy, easygoing dogs that I can handle without having to muzzle. You ask any veterinarian if they enjoy muzzling dogs and wrestling with them, and they're going to tell you, no, it's not a pleasant experience for anyone. Libido is sex drive, and that's kind of interesting because we kind of assume that all dogs know how to do this. We assume the female knows how to breed. We assume the male knows how to mount her and manage a breeding. And the answer is it doesn't always work that way. Sometimes you have an inexperienced dog and he may be a little bit shy about being handled. If he's at the vet clinic, we try to have a minimum number of people in the room. We try not to do any part of a physical exam until we've got the semen collected, because it's a little bit rude to do a rectal exam and then expect the dog to collect semen. We try to have not too many people, no people wearing white coats, no loud noises, nothing that's going to be difficult for the dog to just focus on what he's supposed to be doing. No weird smells. The only thing we do in the room where we collect semen on the dogs is collect semen. We don't want to do blood samples. We don't want to do anything else there because we want him to call that his happy place. So when he comes to the vet clinic, he is looking forward to that. We have dogs that run in the front door and they're very disappointed when they go in to get an ultrasound or an x-ray instead of seeing a female. They're like, oh, but we're in the wrong room. So they all know pretty quickly. So if you have a dog that's a little bit reluctant and he's kind of inexperienced, maybe you need to find a really nice, experienced female for his first mating experience. At what age should you start breeding the dog? And the answer is, as soon as he's sexually mature, he's probably old enough. He needs to have that jump in testicle size where they go from being little tiny testicles to fairly mature feeling. And that happens pretty quickly over the course of a few weeks when they mature. So you shouldn't try to breed him until his testicles are fully mature. Most of the time we recommend that you wait until they're old enough to have their health screenings done. And that depends on your breed and what the chick website says and all those things. So we're not going to get into every breed on that. What age should you stop? And I know there are some states that have requirements for what age you no longer breed your dog after, especially for the females, but even for the males. And I like breeding old stud dogs. If I have an old stud dog that walks in my door, he's 12 years old, he's orthopedically sound, he can still produce sperm, he still can mate a female, I love that. I want dogs that are going to live to be old. And I think most of the people that buy puppies want dogs that live to be old. So if I have a 12-year-old, 14-year-old dog and he's still capable of breeding, go for it. I think that's a great testament to his longevity. Again, then structure is a very important thing. Looking at structure, it's not just about OFA x-rays and those kinds of things. It's really about your breed standard. And even some of the breeds like the Golden Doodles will have a breed standard, even though they're technically not a purebred dog. They are a dog that is purpose bred and they have a breed standard. So look to your breed standard if you have one. And I love this video called The Puppy Puzzle by Pat Hastings. It's no longer being produced. So if you're looking for one, you should get a hold of one fairly soon. It goes through all the structural things, regardless of what breed you have, how to look at fronts, how to look at top lines, how to look at tail sets, how to look at head types. A lot of really great information is in this video. So now that Pat has passed away, her daughter's no longer producing these. So get your hands on one sooner rather than later. And then we have STDs, sexually transmitted diseases. That can include brucellosis, mycoplasma, maybe, strep G, maybe. The important thing about brucellosis is it's not an eradicated disease. We still see it in the United States. We see it in imported dogs. We can see it in native dogs. We can see it in boarding kennels and breeding kennels. So this is a concern because the test kit that we used to have and had for 40 some years from Zoetis is no longer on the market. So there's no longer an in-house test that your veterinarian can run and give you an answer in 20 minutes that is FDA approved. You can buy these other tests. They're made in China. We don't have any FDA approval. We have no kind of quantification on the accuracy of these tests. So we are now recommending, based on the Society for Theriogenology's information, that these tests get sent out to a reference lab. So you want to talk to your veterinarian, get these tests done at least a week ahead of time, because it has to be shipped out and has to be returned with results. So it's not that 20-minute test anymore. If you end up with brucellosis in your boarding kennel or your breeding kennel, the state has the authority in most states to come in, test all your dogs under your cost, quarantine any dogs that are positive, retest every 30 days for a total of 90 days, and potentially euthanize all the dogs that are affected. So don't take this lightly. It's a disease that needs to be taken very seriously on the veterinary side and the human side, because it can be spread to people. So you want to be very, very careful in these situations. So those tests need to be sent out, and we do have recommendations on the Therio website. So if you go to therio.org, it's therio.org. You can go to the position statements, and there's information there for your veterinarian to evaluate. Mycoplasma is kind of a hot button because some people think it causes all kinds of fertility issues. Other people don't think it's serious. Fact of the matter is we can find mycoplasma in normal dogs, and we can find mycoplasma in infertile dogs. So I don't have a good answer for you on that. And the same with strep G. We usually don't see that, but we have cultured it at times and put these dogs on antibiotics, males and females. So if it's cultured, then it may be an appropriate drug or appropriate disease to treat with an antibiotic. Semen analysis. We're going to go through this fairly quickly. There's 4 parts to the semen analysis. It's motility, morphology, count, and longevity. It's much easier to assess a male than a female. Motility is the sperm swimming, not mobility, motility. Morphology is the size and shape of the sperm. Count is how many sperm are present, and longevity is how long is it alive in extender. Just because you see sperm doesn't mean the bitch is or the stud dog is fertile. You need to look at it under the microscope and assess it. If you want to do your own semen analysis, we have all the equipment that you need at Revival. We have collection sleeves. Don't use latex. We have parafilm to cover the tops of the tubes. We have a pipette that you can pull up the semen in. We have pipettes that you can then do the insemination with, and you want to use that semen safe syringe without the black latex. We'll want a tube, a centrifuge so that you can remove the additional fluid if you collect more than you want. And then you want to centrifuge your sample very slowly, so no higher than 1200 RPM. Extenders are a great tool to add if you're having some low volume or some issues. You'll want either a microscope or the iSperm. We'll talk about that in a minute. You want to have a way to keep the semen warm, microscope slides and cover slips, stain to look at the sperm width. So no latex gloves, wear the nitriles. We use the Priority Care, which is a non-spermicidal jelly to lubricate the male's penis. And then we want to take a look at the ejaculate. Like I said, it should be milky white, not bloody, not yellow. How much do you have is an important factor in calculating your sperm count. And then the sperm count is approximately 10 times the dog's weight in pounds. So a 50-pound dog should have 500 million sperm. A 100-pound dog should have 1 billion sperm, except for bulldogs, and they break all the rules. They all have 1 billion. So when you're collecting the semen, you typically only need to collect the second part of the ejaculate. That's the sperm-rich fraction. The beginning is clear prostatic fluid. The end is clear prostatic fluid. The middle part, the second part, is where the good stuff is, where the sperm is. So again, here's your shopping list of things that you'll want to have if you are going to be collecting and inseminating your bitches. Now the iSperm is a really cool piece of equipment that's new to us at Revival. So we do want to talk about that for a minute. And it's essentially got a lens that you put on the lens of the iPad. You put your semen sample on that lens and it can calculate what your dog's sperm count is. So when we were in South Dakota, we had this darling little 8-year-old girl who wanted to see what we were doing. So her mother came up with her and we showed her one time how to do the semen analysis. So that's her mom in the background taking her picture. So in the tube is the semen. She's drawing up the amount of semen that she needs for the count into a pipette. From the pipette, she's putting it on the lens that will go onto the iPad. So she's putting a drop of semen on there, puts down her pipette. Then she's going to put the lens on it that has to go before it attaches to the iPad. She's going to just snap that on. So she saw this once, to let you know. She saw it once and was able to do this with one demonstration. She's putting it onto the lens of the iPad here. And then the program on the iPad does the rest. It does the calculation of motility, morphology, count, all that stuff. So there she is, 90 seconds, one demonstration, 8 years old. So if she can do it, pretty much any of you can do it. So it's a pretty cool device. So how much sperm do you need? Well, we typically want 80% or more of the semen to look normal. We want at least 100 million sperm, and for giant breed dogs, up to 250 million sperm. But it's much more important that we don't overlook that we also have to have fertility of the female. Under the microscope, we'll see different kinds of lighting show us different kinds of sperm, so you can see how they should look. These are sperm that are abnormal. The one on the left has a proximal droplet. The one in the center has a detached tail. And the one on the right has a coiled tail. None of these sperm are normal. These typically won't get your females pregnant. Under the microscope, this is on my TV screen in my exam room. This is what normal sperm should look like. Very motile, very active. Very quickly, you can see that that looks normal. So that's a good quality semen sample. Motility, again, it should be at least rapidly moving forward. If it's too crowded, you might have to dilute it down a little bit, but speed of progression is measured P1 through P5, and it's just an eyeball estimation with P5 being the fastest. This is sort of a funny little cloud that I saw one day on my way home from work. I kind of thought that it was interesting that it looked like a sperm, but it was heading the wrong direction. Remember, they never asked for direction. This is another normal sperm sample that you can see in closer view. They should be looking like this, swimming very quickly and swimming across the screen. So that's what normal sperm looks like. But this is a sample of semen that is 70% abnormal. You can see they have a lot of coiled tails. They're not swimming. If they're swimming, they're not swimming in a linear direction. Some of them have 2 heads, so you can see that there's some significant differences. So this is a dog that doesn't have good fertility. Morphology, again, should have the head of the sperm should have an acrosome, which is a cap on the end of it. That's where the enzymes are that allow it to penetrate the egg, which is on the right-hand side. It should have a neck, and then it should have a tail. So it's a pretty simple anatomy. The joke is, why do we need all those sperm? And the answer is, bad news in this class is that 99% of you will fail, because we do need more than one sperm to penetrate the egg. We need more than one sperm to have that enzyme to penetrate through the zona pellucida, but we certainly don't need 1 billion sperm for most breedings. There are 2 kinds of sperm defects that we see. The major defects are of the head or the neck. The minor defects are of the tails, but any defect is reason for concern and reason to talk to your veterinarian about treatment. So if you see blood in the ejaculate, this can come from the prostate. This can come from trauma to the penis. Blood in the ejaculate of a dog does not damage canine semen. It does horse semen. But if you have blood in the ejaculate, you should be talking to your veterinarian about what's going on and how you can manage that. Sperm should live in semen extender, at least 24 to 48 hours. It's easy to refrigerate that before you sip a sample, or if you're having fertility issues with a male to see if his semen is dying too quickly, that you can put it in extender, pop it in your fridge, rewarm it, and then relook at it under the microscope. It does require a microscope to do that. We do have multiple kinds of semen extenders on the market. The one we carry is the Kenny, which is a milk-based product. And if you do have the option of using one, I always order the one with antibiotic, and it adds $1 to the cost of it, so it's not much. If we are going to collect the stud dog, and these are old pictures from a website that I took them off of, this person should be wearing exam gloves and they should not be using a latex sleeve, but it does show a nice example of exteriorizing the penis, getting the sleeve put over it, and then the erect penis with the bulb after the dog is done collecting. That's all normal looking. This is a video that we took at our practice. This is a German Shepherd that Katie, my technician, was collecting. We have a female in the cage because he wasn't a friendly dog, so we didn't want to have the female right in front of him. So she's just stimulating him, put the sleeve on, and is stimulating him to ejaculate. But I want you to remember that even if you know the stud dog and you think you know him pretty well, that you need to be careful, because this dog is cooperating and he's letting Kitty Cat collect his semen. But in the slide just ahead of this, which I didn't show you at the beginning, this is what he looked like when she reached down to collect him. You saw him lip licking, you saw him turning at her. He wasn't real happy because he wasn't really sure what was happening. So be careful that you're not going to get somebody hurt, because you're right at eye level with these guys. So be cautious when you're collecting them. An additional technique that can be helpful when you're collecting a dog, if he's a little reluctant to collect, is if you very gently flick the tip of the penis through the sleeve. Sometimes that will stimulate him to collect better as well. I'm not sure how that simulates anything in a female, but this is one of my corgis, and he did collect better with that little technique. The Get Him Going is to improve libido. It's got horny goat weed in it, and that does improve libido on some of the dogs that are reluctant. Oxy Stud is a good general product to use during the time that you're using him for breeding and kind of expecting him to perform at a high level. If you're breeding multiple bitches during one heat cycle, or during one cycle that you have multiple females in at the same time. In between for him, we have an in between for her as well, which is helpful in between breeding seasons to keep their semen quality up. And then Problem Male is what we would use for any dog that had abnormalities, low sperm counts, coiled tails, anything that's abnormal. Those are some products that can be helpful. And there's a lot of detail on the website.
We do have a few questions that people have asked. A couple questions on food. A few people asked about that. You did mention some foods at the beginning, and they were wondering if you could name those again. They were trying to write it down. And then also somebody's kind of asking, using that versus raw food and, appropriate diets there. What are your thoughts on organic and raw versus processed foods?
Yeah, raw is never my favorite. I have a lot of concerns about bacteria and parasites, and having a balanced diet, there's sometimes nutritional excesses and nutritional deficiencies. I know raw is a pretty hot topic, and especially in bitches that we're breeding, I'm not a fan at all. My favorite foods for feeding our stud dogs and our bitches that we're breeding are going to be Royal Canin. They make an HT42D, which is the pregnancy diet, the only one on the market. You feed it from the start of the heat cycle to the 42nd day of pregnancy, HT42D, but it does work for your stud dogs as well because it has some anti-inflammatory properties without drugs. Any of the Royal Canin reproduction line, the mama and baby dog, the puppy, all of those are great products. I personally feed Royal Canin. Purina also makes their sport line, their Purina Sport 3020, which is a 30% protein, 20% fat. Again, very helpful. When I have people with fertility issues, male or female, my first 3 questions are, what do you feed? What else do you feed? And what supplements are they on? And that frequently will get us to an answer, a solution fairly quickly, because there are some brands of food that we have very low fertility with. And of course, they won't tell you that. That's just what we're experiencing.
Okay. Stan is wondering, he has a male and female Shih Tzu, but he is a little shorter than her, and he wants to mount her, and she's receptive, but he doesn't ever make it to her spot. Any advice on how to help him the next time she comes into heat? He said they have excellent bloodlines, so they really want to have them have a litter. So any thoughts there?
Yeah, you can always do a collection, an AI, but you can also lower her or raise him a little bit. So you can put him on a platform, you can put him on a stoop. If you're outside, you can dig a little ditch, a little hole for her to stand her back feet in, so he's a little higher than she is. Oftentimes, if you try to direct the penis in, you just shut them down. So most of the time, we either want to try to help them get at the same level with, you've got pallets and boards and, come up with something. We used to have a J.C. Penney catalog, a phone book, and a Sears catalog that were 3 inches thick. Those don't happen anymore. So you're going to have to do this with your own ingenuity.
Okay. Laura's wondering a couple questions on the supplements here. First, well, would you recommend any supplements for the stud if he's never had any issues producing pups? Are they needed? And which ones would you recommend there? And Laura's kind of wondering, would you recommend problem male and the in-between for him as well?
Typically, we'll just use one. And if you're not having any problems, I think just a good basic oxy stud is probably the way to go. I think it's helpful because we don't really know what our commercially available diets other than the Royal Canin and the Purina do for fertility. So I think it's always a good idea to support our stud dogs, especially if they're going to be doing breeding more than one female in a short period of time. I think he needs that support.
Pete's wondering how many times and how often should a stud dog mate with a female?
Well, I guess that's a hard question to answer. Do you mean how many times on that heat cycle? Typically 2 breedings with good timing is all we would need. So progesterone testing so that we know the timing is correct. We see people that start trying to breed so early that either the female is snarky to the male and then he shuts down, or he breeds her so many times and then his semen quality is depleted because he may not be young and producing that replenishment of sperm fast enough that by the time she gets to the fertile part of her heat cycle, he's basically producing so few sperm that it's not going to get her pregnant. So that timing with progesterone and just getting 2 really good breedings are probably the ideal way to go.
Okay. Deanna's wondering, are you okay with a stud dog taking Simparica in a state with widespread tick diseases and heartworm?
No. Simparica, Credelio, and NexGard are not approved for use in breeding animals. The only one that is Bravecto. So the oral of those 4 medications, the oral Bravecto is the only one that has testing done on it, and it's been proven to be safe. So you can use Bravecto, and then you would just need to use a heartworm preventive because Bravecto at this time doesn't have heartworm preventive in it as well. It does flea and tick. So then you want to use something like HeartGuard that is, again, tested and useful in breeding animals. We do have a flea and tick finder feature on our website, which you can go in and it goes through a series of questions based on your dog's age and their reproductive capacity and all those things. It'll walk you right through which products can be used that are known to be safe.
Okay, Jennifer's wondering, does the AKC have an age limitation for the sire in order to register the puppies?
They don't, to my knowledge, have a youngest age requirement. They do have an oldest. After age 12, all you need is a letter from your veterinarian that says he's still producing fertile sperm. So yes, they do, but it doesn't mean you can't register the puppies. It just means you need to trot into your vet, get a semen collection done, and they'll write you a letter that says he's good to go.
Okay. Somebody's wondering about the semen extenders. You mentioned a couple. Which can you mention, I guess, a little bit more about which ones you recommend?
Sure. We use the Kinney. We sell the Kinney, which is a milk-based product. There are many on the market. I think in general, they're all good for all dogs. There's a few dogs that will do better in certain extenders. So Minitube makes one, ICSB makes one, that's International Canine Semen Bank. Symbiotics makes one, Camelot Farms makes one. So there are several on the market, but it just depends on your dog. So you can test them if you have a dog. So we see some breeds that just are kind of fussy about their semen quality. So sometimes we have to do test chills. So we'll take 4 extenders, we'll collect that semen, we'll put it in 4 different extenders, put it in the fridge, pull it out at 24 hours, pull it out at 48 hours, and look at it under the microscope and determine which one works best for that particular dog.
Okay, we'll do one last question here. Brenda's wondering, how common is cryptocorid? I don't know if I said that right. Is it becoming a more common event, and is it passed from the stud or the female?
Cryptorchidism is the term. It means retained testicle. I don't think it's more common. I actually think it's probably less common than it used to be. Nobody has figured out the inheritance pattern, but it probably takes 2 to tango. It probably takes it coming from both the male and the female side, but we just don't have good information on it. One of these days we'll have a DNA test for it. We have DNA tests for 350 things. One of these days that'll show up on our panels. But at this point, we don't know because it doesn't express itself in the female side, but we suspect that it requires a female and male contribution to make that happen. And it's probably not going to come back as a simple autosomal recessive test, because those are always the nicest ones to interpret. We'll figure it out eventually, but right now we don't know.
Okay. Well, we always have way more questions than we have time for. If we did not get your question answered, we apologize, but we encourage you, call our Revival Pet Care Pros. That number there is on your screen, 800-786-4751. As I mentioned earlier, they work very closely with Dr. Greer. If they don't know the answer, they will reach out to her. So make sure to give them a call and they will help you with any questions you have. If you don't already, again, sign up for our Revival text messages. That'll give you notifications for our next webinars. It'll give you promotion details, money-saving offers, and pet health resources, because who doesn't like those? Again, follow us, Facebook, Instagram, YouTube. We are on all of those social platforms, and we'd love to have you follow us. Again, thank you so much, Dr. Greer. Always so much great information you share with us. Thank you, everybody, for joining us today. We hope you have a great rest of your day.
Yes.
Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel. If you have a pet health question, call our Pet Care Pros at this number. And don't miss our other pet health videos.